Now we are going to tackle the vasculature of the upper limb. If you have checked out any of the Netter's Atlas of Human Anatomy textbooks, or really any gross anatomy book, you can see that learning vasculature can be a very daunting subject. You've got a lot of very complex images, all at different angles of quite often very small structures. So what we're going to do here is simplify it. I'm going to give you all of the arteries all the way from the heart out to the fingertip, what those arteries are called, and exactly what muscles those arteries give supply to. So because we're starting with the heart, there are going to be a couple proximal structures that you guys won't need to know for that upper limb examination, but I'm going to include just to be consistent. So those I'm going to have in this nice little green color here. Starting with the heart, we know out of the left atrium, blood will be pumped into the arch of the aorta, and then into the descending aorta going down into the abdomen. Off of this, we have our brachiocephalic artery, which will bifurcate into our right common carotid and our right subclavian. We'll have our left common carotid right there, so the common carotids will go up into the head. Don't need to know those yet. But what we do need to know is directly off of the arch of the aorta, we have our left subclavian artery. So this artery will proceed laterally until it hits a very important landmark, the first rib. So after that subclavian artery passes over the first rib, it will then be called the axillary artery, and this is where we start to have some fun. So we're going to zoom in on this, and there's a really easy mnemonic that we can use to remember all of the branches coming off of that axillary artery. So let's go ahead and draw those branches first. We've got one artery coming down here, passing inferiorly. You've got a large trunk coming off superiorly. This trunk will give off 4 branches. There we go. We'll have another artery coming down like this. We'll have a trunk passing inferiorly, and that trunk will bifurcate to 2 branches. And then finally we have 2 a little bit smaller arteries coming off at the end. So this is how the mnemonic goes. There we go. We have 60s, teens, love, sex, and pot. So 60s, teens, love, sex, and pot. Teens will grow up, so this passes superiorly, and they die. And when they die, they become cadavers, and cadavers are dead people. So we have 60s, teens. Teens grow up and die. They become cadavers. Cadavers are dead people. Now with sex, sex is a really big deal. It's a really big trunk. When you have sex, often you go down first, so this trunk passes inferiorly. And if you have sex, you can acquire an STD. So you have 60s, teens, love, sex, and pot. Now, let's zoom out and we'll learn the actual names of all of these arteries. 60s stands for superior thoracic artery. This artery will pass inferiorly, and it will give blood supply to the first intercostal space. There we go. So the T stands for thoracoacromial trunk. So you can call it thoracoacromial artery. I much prefer to call it thoracoacromial trunk because when I call it a trunk, I know that something comes off of it. So the thoracoacromial trunk has 4 branches. For cadavers, we have the clavicular branch. For R, we have acromial branch. For D, we have deltoid branch. And for P, we have pectoral branch. So that clavicular branch will pass and give blood supply to that small subclavius muscle. That's between the first rib and the clavicle, keeps it tight against the thoracic cage. That acromial branch will pass over that acromion, give blood supply to it and also to the lateral head of the deltoid. So next we have that deltoid branch, and this branch will pass through what is known as the deltopectoral triangle. So if you can remember from the musculature component, we learned that we have the anterior head of the deltoid. So imagine that is sitting right over here. And we have pec major right here. And there's a little gap between those 2 muscles on their insertions. So remember, the pectoralis major inserts up on the clavicle. The clavicular head right here. There's a little bit of a gap before we have that anterior head of the deltoid. So this will be filled with a little bit of fascia. And passing through that, we will have that deltoid branch. And also the cephalic vein. And so that deltoid branch will then give blood supply to that anterior deltoid. Finally, we have the pectoral branch, which will, as the name implies, give blood supply to that pectoralis major and minor muscles. It will pass between those two muscles, giving supply to them. Love is next on the list, and this stands for lateral thoracic artery. Now, this artery will give blood supply to a very important muscle, the serratus anterior. Now, very important with both the lateral thoracic artery and the long thoracic nerve. Both of those go to serratus anterior, and they are the only superficial neurovascular structures that we will cover. So keep those in mind for your lecture examinations. Next, we have SEX. This stands for subscapular trunk. Again, I like to call it a trunk because that lets me know something comes off of it. You can acquire an STD. That stands for scapular circumflex. The scapular circumflex. Now, we'll have to remember another structure that we learned. So I'm going to draw it right here. I want you to imagine for a moment that this is teres minor muscle right here, teres major muscle right here. We have the humerus and long head of triceps. Now, we discussed this a little bit with a finger method in the musculature component that I would highly recommend you learning for that laboratory examination. So pretend that these are those fingers. We have our quadrangular space right here, triangular space here, triangular interval down here. So this circumflex scapular artery will pass through that triangular space and give blood supply to the teres major and minor muscles. There we go. And finally, we have TD, standing for thoracodorsal artery, which will give blood supply to your latissimus dorsi. So we have 60s teens, love sex, and pot. Finally, last two, very easy. And stands for anterior circumflex humeral artery, which will give blood supply to the humeral head and anterior shoulder. And finally, the posterior circumflex humeral artery. Now again, let's come and draw what we learned in that musculature component. We have our quadrangular space, triangular space, triangular interval. This posterior circumflex humeral artery will pass through that quadrangular space, and it will give blood supply to the posterior head of the deltoid. Let's do a very quick recap of what we just learned for the branches of the axillary artery. We have 60s, teens, love, sex, and pot. Teens, they grow up and they die. This trunk goes up. Ooh, there we go. Trunk goes up, and if you die, you become a cadaver. Cadavers are dead people. Sex, it's a really big deal. It's a really big trunk. If you have sex, usually you go down first, and if you do that, you can acquire an STD. So those stand for the superior thoracic artery, which gives blood supply to that first intercostal space, the clavicular branch of the thoracoacromial trunk, which gives blood supply to the subclavius muscle, the acromial branch of the thoracoacromial trunk, which gives blood supply to the acromion and deltoid, the deltoid branch, which passes through that deltopectoral triangle. So we've got the clavicle here, insertion of the pectoralis major here, insertion of the anterior deltoid, little gap with some fascia tissue. It'll pass out of that and give blood supply to the anterior deltoid. The pectoral branch going to the pectoralis major and minor. We have the lateral thoracic artery giving blood supply to the serratus anterior muscle. We have the subscapular trunk bifurcating into the scapular circumflex artery, which passes out of that triangular space, giving blood supply to the teres major and minor muscles. We have the thoracodorsal branch of that subscapular trunk, giving blood supply to the latissimus dorsi. And finally, we have the anterior and posterior circumflex humeral arteries, giving blood supply to the head of the humerus and shoulder joint, and that posterior circumflex humeral passing out of the quadrangular space to give blood supply to that posterior head of the deltoid. So if you want to take a picture or a screenshot of this, I would do that now. What I'm going to do is clean up our visual and move on to the rest of the arteries that we need to cover. Okay, so I've cleaned up our image a little bit, but you can see that I've left intact all of the branches of the axillary artery, even though they're not labeled anymore. So The axillary artery will proceed laterally until it hits another anatomical landmark, the border of teres major, and after it passes that, it will then be known as the brachial artery. This artery will pass down into the arm. Now, let's do a quick mental check. If you guys were with me for the muscular component, you remember the axio-appendicular muscles and the scapulohumeral muscles. Well, in that list, there were a couple muscles that we haven't given blood supply to. So, if you notice that, good on you. Let's come back here and take a look again. So remember, this green color means that we do not necessarily need to know it for that upper limb examination, but I'm going to put them in there to be consistent. So first, off of this subclavian artery, we're going to have a vertebral artery. Then we're going to have an internal thoracic artery coming down like this. Then we're going to have our thyrocervical trunk. Again, green color, don't need to know it. It's going to have a little inferior thyroid branch coming off of that. It's also going to give off this branch right here that we do need to know, which will bifurcate into two other arteries that we need to know, and another one popping off here. Now, before I label these, there is another trunk off of that left subclavian, the costocervical trunk, which will have two arteries coming off of it that, again, we don't need to know. So let's come in on this a little bit. Unfortunately, I don't have a great acronym to remember these guys. This first one is the transverse cervical artery that will bifurcate into the superficial cervical and the dorsal scapular arteries. Now, both of these, superficial cervical and dorsal scapular, will give blood supply to this very large trapezius muscle. Dorsal scapular will also by itself give blood supply to both the levator scapulae and the rhomboids, both rhomboid major and minor. And finally, we have the suprascapular artery that will give blood supply to the supraspinatus and infraspinatus muscles. So with all of these together, we have covered all of the axio-appendicular muscles and their supply, and all of these scapulohumeral muscles and their supply. So again, if you want to take a screenshot, do that now, and we'll move on to the vasculature of the brachium. So let's do a quick recap of everything that we've covered so far. We start always with the heart. We have the arch of the aorta. We have the left subclavian artery, passing the border of the first rib, becoming the axillary artery, which then passes the border of teres major and descends into the arm as the brachial artery. Up until this point, all of the arteries have been presented in one plane. But from here on out, red will be located more anteriorly, and blue, like this, will be located more posteriorly. So, like I said, we have the brachial artery here, and this one in blue is what is known as the profunda brachii, or deep brachial artery. So if I were to draw a cross-section of the brachium, here's my little cross-section, and so let's think of this as an MRI view. So we're looking from inferior to superior. I could split this into, located more anteriorly, the flexor compartment of the brachium, which contains the coracobrachialis and biceps brachii, and the posterior or extensor compartment containing the triceps and the anconias. So the brachial artery and the profunda brachii give blood supply to each of their respective compartments. So the brachial artery will supply all in the flexor compartment, and the profunda brachii will provide blood supply to all in the extensor compartment, as you can see with my nice little pokeball here. So let's get rid of this. So that's pretty much all you need to know for the brachium. Very, very simple stuff. So the brachial artery will then proceed inferiorly until it hits what is known as the cubital fossa. So at your desk right now, if you were to supinate your hand and flex the muscles of your antebrachium and your brachium, you'll see a little indentation right on the anterior surface of your elbow. That is your cubital fossa. And it is here where that brachial artery will bifurcate into the ulnar artery medially and the radial artery laterally. Draw these labels in. There we go. Ulnar artery and radial artery. Now the ulnar artery will give off a smaller branch known as the common interosseous artery. So notice it's red, it's still located more anteriorly. So this is common interosseous. Now, remember the word interosseous means in between bones. So in the osteology component, we discussed the interosseous membrane located between the ulna and the radius. Well, this common interosseous artery will bifurcate into two arteries, the anterior interosseous artery and the posterior interosseous artery. So notice I'm using blue, meaning it's a little bit more posterior. So here we have our anterior interosseous artery and posterior interosseous artery. From here on, moving inferiorly, we're going to be dealing with the antebrachium. And what I've discussed so far is what you need to know for the brachium in the brachial artery and the profunda brachii. But some schools might require, for the lecture component, not so much the lab, you to know some of the collateral and recurrent arteries that occur here. So you'll notice that I stopped the profunda brachii right here. But in actuality, the profunda brachii is not a terminal artery, and that it doesn't just diffuse out into the muscles and then stop. There are actually some arteries that come off of it. And this is, again, very detailed stuff. Not all schools require it, so if you don't need to know it, just fast forward until we get into the antebrachium. So for those of you who do need to know it, profunda brachii will bifurcate. It'll give off a little artery medially, right? And see, that's blue, so it's located more posteriorly. And it'll give off another artery laterally. And these are the middle collateral artery and radial collateral artery. Now these two will anastomose with a interosseous recurrent artery that comes off of that posterior interosseous artery, and with a radial collateral artery which comes off of the radial artery. Very important distinction there. So we have our interosseous recurrent artery and our radial recurrent artery. Now, from the brachial artery, there are a couple more branches that come off. So directly off the brachial artery, moving more posteriorly, we have our superior ulnar collateral artery that will anastomose with the posterior ulnar recurrent artery. This will come off of the ulna proximal to where the common interosseous artery comes off right down here. So these are our superior ulnar collateral and posterior ulnar recurrent. And as the name implies, if there's a superior ulnar collateral, there's probably an inferior ulnar collateral that will anastomose with an anterior ulnar recurrent. So let's move this in. Inferior ulnar collateral and anterior ulnar recurrent. For the more advanced classes, when you need to know all these collateral and recurrent arteries, I said earlier that the flexor compartment of the brachium is supplied by the brachial artery. And that is true, but more specifically, coracobrachialis and biceps brachii are both supplied by the brachial artery, but the brachialis muscle is actually supplied by the radial recurrent artery. And with the triceps, the profunda brachii is the main blood supply, but for the anconeus, it's actually the interosseous recurrent. In most laboratories, you will not need to dissect the collateral and recurrent arteries. You will, however, most likely need to dissect the common interosseous and both the anterior and posterior interosseous arteries. So if you want to take a screenshot, do it now. I'm going to clean it up and we'll move on to the antebrachium. So again, let's do a very quick recap of everything that we've covered thus far. Start always with the heart, arch of the aorta, left subclavian, past first rib, axillary artery, past teres major. We have our brachial artery giving off our profunda brachii. We have our brachial artery descending into the cubital fossa, which will then bifurcate into the ulnar artery medially and the radial artery laterally. So let's now get into the antebrachium. From this bifurcation, we have ulnar artery proceeding inferiorly, radial artery proceeding inferiorly, and these anterior and posterior interosseous arteries will also proceed inferiorly. So if you remember from the muscular component, there were quite a few muscles in the antebrachium. So just like I did with the brachium, we'll draw a quick cross section, right? So we'll do an MRI view again. So we're looking inferior to superior. In the forearm, there are two bones. We have the ulna here, from the radius here, right? And so these will have that common interosseous artery between them. So were I to draw the arteries, we would have the ulnar artery somewhere around here. We'll have the radial artery somewhere around here. We'll have that anterior interosseous artery right here, right on top of that interosseous membrane in between the ulna and the radius. And then we'll have the posterior interosseous artery right here. So when I draw it like this, it simplifies trying to explain which muscles are given blood supply by which arteries. So let's divide this into a few components. So were I to ask you what muscles were supplied by the ulna, you would say any muscles pretty much in the anterior and medial compartment of the antebrachium. So that could be all of those pass-fail muscles. So pronator teres, palmaris longus, flexor carpi ulnaris, all of those. Were I to ask you what the blood supply or what the radial artery supplied, it would be those superficial muscles like the brachioradialis and extensor carpi radialis longus. Now were I to ask you what muscles the anterior interosseous supplied, it would be all those muscles very, very close to that interosseous membrane. So like the flexor pollicis longus and the flexor digitorum superficialis. Now you will notice that there are a lot of arteries in the anterior compartment up here, but there's only one in this posterior compartment. So that posterior interosseous artery will give blood supply to all of those posterior extensors. So we're talking extensor digitorum, abductor pollicis longus, all those guys. So I really wouldn't suggest spending a whole lot of time trying to remember exactly which antebrachial muscles are supplied by exactly which artery. I've never seen a test question, either in lecture or lab, cover that in that much detail. So when you really want to get nitpicky, it's more in the nerves. You need to know exactly which nerves innervate exactly which muscles, but arterial supply, not so much. The ulnar artery will proceed through the antebrachium, and then it will enter into the hand. So from this point and down, this point and distally, this is going to be the hand down in here. So that ulnar artery will come down, and it will give off most of the contributions to what is known as the superficial palmar arch. The radial artery will come down, and it will also give off a contribution to that superficial palmar arch, but less so. Most of the blood will come from the ulnar artery over here. The radial artery will give off most of the contributions for what is known as the deep palmar arch. Right? So it's in blue, which means it's below the superficial. And this will also anastomose with the ulnar artery, but most of the blood, again, will come from that radial artery. We've got our ulnar artery here, our radial artery here. Now the anterior interosseous artery will come down also. It's sitting right on the anterior surface of the interosseous membrane. At the very end, it'll actually poke through that again and will anastomose with the posterior interosseous artery. Usually you could just call this the end. However, I will say that the posterior interosseous artery is not a terminal artery in itself. It will actually come down here and give off a couple carpal arches, which again are like the recurrent and collaterals. They're very nitpicky stuff. Most professors won't ask about it, but after we cover all the big stuff in the hand, then I will go back and explain it a little bit more in depth. Got our anterior interosseous here, posterior interosseous here. We've got our superficial palmar arch with most of the contributions coming from that ulnar artery, and we've got our deep palmar arch. We are down in the fingers now. The ulnar artery is sitting more medially, which means on this side we're going to have our pinky or fifth digit. We're going to have 4, 3, 2, and then a big old thumb right there. Perfect. The superficial palmar arch will give off what are known as common palmar digital arteries. It'll make sense in a minute, I promise. We've got our common palmar digital arteries right here. There we go. Get a couple more in there. And these common palmar digital arteries will bifurcate into what are known as proper palmar digital arteries. Here we have proper palmar digital arteries. This is referring to these guys, and this is referring to the ones right here and right here. So notice for the pinky, the common palmar digital artery does not bifurcate, it just stays by itself. But all these other ones do. Off of that deep palmar arch, you'll actually probably first notice that the thumb is pretty lonely out there. So we're going to give off some contributions from that deep palmar arch. I'll have a really big one known as the princeps pollicis, and another one known as the radialis indicis to the index finger. Radialis indicis, radial side, index finger, it all makes sense. So we have our princeps pollicis right here, and our radialis indicis right here. Now, finally, these are not the only two branches that come off of that deep palmar arch. We're going to have a couple smaller ones known as palmar metacarpal arteries that will come off and anastomose into those common palmar digital arteries. So I'll draw it underneath that superficial palmar arch, coming into those common palmars. Draw these labels in here real quick. Let's recap. We have our ulnar artery up top here, which will come down into the hand after this line, and will give off most of the contributions to the superficial palmar arch, this large arch right here. That superficial palmar arch will give off these common palmar digital arteries. Digits 4, 3, and 2 have a common palmar digital artery that will bifurcate into proper palmar digital arteries here. So that superficial palmar arch will also anastomose with the radial artery, but most of the blood supply will come from the ulnar artery. The radial artery will give off most of the blood supply to the deep palmar arch, seen right here. And that deep palmar arch will give off a large princeps pollicis artery going to the thumb, and a large radialis indicis artery going to the index finger. It will also give off these palmar metacarpal arteries that will rise up and anastomose with the common palmar digital arteries. So if you want to take a screenshot, do it now. I'm going to minimize this and give you guys a different perspective or a different angle of what we just learned. Let's take a different perspective for the arteries of the hand. So let's say that this is the radial artery, and this is the ulnar artery, and we're looking at a left hand with thumb going more towards the page and the pinky coming out towards us. So we've got our radial artery here, radial artery is thumb side, and ulnar artery here, ulnar artery is pinky side. And so coming off of that ulnar artery, we have our superficial palmar arch, which still anastomoses with the radial, but most of the blood comes from the ulnar. From the radial, we have our deep palmar arch, still anastomoses with the ulnar, but most comes from the radial. Off of this superficial palmar arch, we have our common palmar digital arteries and our proper palmar digital arteries. So we have our superficial palmar arch, we have our common palmar digital arteries, and we have our proper palmar digital arteries. Off that deep palmar arch, we have the palmar metacarpal arteries that will feed up into those commons. Now, if you remember, I said that the anterior and posterior interosseous arteries were not terminal arteries. So let's go ahead and draw those in here. We've got our anterior interosseous artery there, and our posterior interosseous artery here. The anterior interosseous artery will come down, and it'll actually pass through that anterior interosseous artery into the posterior compartment and anastomose with the posterior interosseous artery. This is in itself, again, not a terminal artery, but will actually anastomose with another arch that we do not need to know. Again, watch this green color. It means we don't necessarily need to know it. And this is our dorsal carpal arch, which comes from both the radial artery and the ulnar artery, with also contributions from that posterior interosseous artery. Dorsal carpal arch here, and this will give off some dorsal metacarpal arteries that will bifurcate into dorsal digital arteries. So you'll notice that the superficial palmar arch is on the palmar surface. So if we get out here, and we'll say we've got a finger here, we'll just say this is the whole finger. We'll have that proper palmar digital arteries up top giving blood supply to the palmar surface, and we'll have those dorsal digital arteries down here giving blood supply to that dorsal surface. So let's get rid of all of this and I'll give you one last perspective. So let's say we're looking at a cross section of a finger. So we've got our carpals down here, right? We've got a metacarpal right here, nice long metacarpal. And then we have our three phalanges. So our proximal, our middle, and our distal. Oh, let me fill these guys in. There we go. Not the prettiest, but they'll work. Since we're looking at a cross section, we'll say that this side is the palmar surface and this side is the dorsal surface. All right. So we're going to have our superficial palmar arch somewhere around right here. And it's going to give off those commons, right? And then somewhere around here, since we're looking at a cross section, we can't see the bifurcation, but somewhere they're going to give off those proper palmar digital arteries. They'll go all the way into the end of the finger, right? Somewhere back here, we're going to have that deep palmar arch. And it'll give off those palmar metacarpal arteries. It'll come into the commons, just like that, right? And then we will have that dorsal carpal arch all the way back here. And it'll give off those dorsal metacarpal arteries that will then themselves bifurcate into dorsal digital arteries. Those dorsal digital arteries don't get all the way to the end of that distal phalanx, so the superficial palmar arch will give off these little perforating branches that'll do the job for them. So this has been the totality of the vasculature of the upper limb. I really hope you guys found this video helpful. If you did, be sure to give it a like and share it with other people who are, in your anatomy classes. And if there's certain things that you think need to be changed or added to it, be sure to leave it in the comment section.